Welcome to this Ability Clinic. I'm Dr. Stephanie. Today we're going to talk about what it takes to be a good doctor. I'm not an expert, but I've had a lot of experiences with doctors, and it's important we evaluate ourselves from time to time. We all want to think we're good doctors, but in reality, we know there's always room for improvement. Being a doctor is hard. We've got to make important clinical decisions, work with time constraints, manage lots and lots of paperwork, and bear the immense responsibility of mistakes or problems that inevitably come up no matter how good we are. There are many ways doctors can be good, but today I want to go back to the basics and go over 5 universal things that we all can and should be doing to be the best doctors we can be. There's a lot of variety in healthcare. There's different types of providers, different specialties, different community settings, but I've tried to come up with 5 things that can apply to any type of clinician, regardless of specialty or experience. And this isn't basic stuff like be organized or be empathetic. We're going to talk about 5 specific tasks, actions, or behaviors that any healthcare provider can focus on to do their job well. Let's get started. Number 1, document so that a colleague can read your note and know what is going on and what you're thinking. Writing notes about patients is something we have to do on a daily basis. It can be time-consuming, and there's all these requirements for what has to be included in a note. But the point of writing a note isn't to meet insurance requirements or to check off a box on the to-do list. It's to communicate to the rest of the healthcare team, and sometimes the legal system, what is going on with a patient and what you think should be done about it. I review about 100 patient charts a month as a consultant, and I love it when a note I'm reading helps me picture a patient as if they're right in front of me. I can tell what's bothering them, what they look like on physical exam, and I can tell why the doctor is recommending certain things in their plan. When a note isn't so helpful, we have to do extra work to hunt through older notes, medication lists, and diagnostic studies to fill in the gaps. Making sure a note is clear and concise helps us organize our own thoughts and remember our plans for the next time we see the patient, which may not be for several months. Good documentation improves communication between doctors, streamlines handoffs between different specialties, and minimizes the work for other providers joining the patient's case, who then don't have to try to guess what's already been done. Unfortunately, documentation requirements have only gotten more lengthy and complex, and our electronic health records make it a little too easy to copy and paste information that may not be accurate or updated. This has really distracted the healthcare system from the fundamental purpose of a doctor's note. Our documentation should give a concise summary of a patient's active issues, describe our thought process and plan, and be easily understandable by other healthcare professionals. That's it. We can be super smart or super experienced, but if we can't communicate our thought process to our colleagues and patients, our skills aren't as helpful as we might think. Number 2, have a system for evaluating patients consistently. At the start of our training, we learn every exhaustive detail of every disease, so it's easy to get caught up in the nitty-gritty and lose sight of the big picture. But we don't reinvent the wheel every time we evaluate a new patient. Once we settle into our specialties, we develop a systematic process for evaluating patients that enables us to detect any problem we could possibly address within the scope of our expertise. It takes practice, but we develop a decision tree in our minds that helps us capture all the pertinent aspects of a patient's presentation, which then leads us to formulate an assessment and plan. This process has to have a solid framework, but also be flexible enough to catch uncommon problems. Throughout our careers, the more we practice evaluating patients with an organized, focused approach, no matter what specialty we're in, we can consistently cast the same wide net and narrow things down from there. We're much less likely to miss something important with this strategy. To keep our decision tree relevant, we also have to stay up to date with medical literature, clinical guidelines, and the standards of care. Number 3, be proactive about giving and receiving feedback. We all have high expectations of ourselves, and we all want to feel like we're doing a good job. Medicine is such a competitive, high-stress field, so it's incredibly uncomfortable for us to give and receive feedback about what we could be doing better. But even the best of us aren't perfect. Let's just face some uncomfortable truths. It's easier than it should be for a doctor to do the bare minimum and face essentially no consequences. Even if someone's patients aren't doing well because of ineffective care, only rarely does a colleague or administrator intervene. So doctors who aren't proactive about improving just continue to perform below the standard, and this creates more work and frustration for their colleagues, but nothing actually happens to help the situation. This is awkward for me to talk about, but one of the skills we have to have as doctors is to talk professionally and productively about uncomfortable things. I've worked at all different types of clinics and hospitals, East Coast to West Coast, some big names you know and some you don't, and I'm fairly confident this type of problem exists everywhere. We need to stop putting ourselves and our colleagues on a pedestal just because we wear white coats and say, studies show. Holding ourselves to a high standard doesn't mean we have to always seem perfect. If we embrace our imperfections and encourage giving and receiving feedback, we set an example that all of our colleagues will hopefully want to aspire to. If you think you're already a good doctor that has nothing to improve on, that kind of thinking is probably preventing you from becoming an even better doctor. Number 4, trust but verify and close the loop. Have you ever asked someone to do something but then later found out it didn't get done? I certainly have. I trusted, but I didn't verify. This is failure to close the loop. If an unfinished task isn't our direct responsibility, it's easy to just blame someone or something else. Of course, we trust ourselves and our colleagues to do a good job. No one intends to drop the ball, but mistakes happen, and it takes a little extra work to verify that the loop is closed. If there's an important update or change in a care plan, it is so meaningful when we can find a few minutes to make that extra phone call to update patients or family members. Or maybe it's an extra phone call to a pharmacy to confirm that a new medication is covered by insurance. Or maybe it's an extra phone call to another specialist to clarify a vague recommendation. Of course, we're really busy. We don't have a lot of time for extras. But taking care of people is our primary responsibility. And that means it's also our responsibility to coordinate care and make sure the plans we work so hard to devise actually happen. Number 5, ask new patients where they're from. I know that sounds kind of simple, but let me explain. People go to the doctors because they're experiencing a serious health issue, maybe the most serious issue they've ever had. Especially if their doctor is a different age, gender, or race than them, it's not really natural for someone to just open up about personal struggles to an unrelatable stranger, even if that stranger is the supposedly good doctor. Patients should be the boss of their own healthcare, and us doctors are just around to help them understand what's going on and offer options for them to choose from. Patients can't advocate for themselves and make informed decisions unless they feel they can trust their doctors. So when we first meet a new patient, it's always a good idea for us to ask them where they're from. This simple question paves the way to a collaborative doctor-patient relationship. You can find out all kinds of fun things by opening with a non-medical question like this. Maybe they've lived in this town their whole life. Or maybe they've lived all over the world. Maybe they end up telling you about their favorite restaurants, their interesting career, or their quirky hobbies. These things don't always come up if you just start with, "How can I help you?" That should be your next question, of course. Yes, being a doctor is hard, and being a good doctor is even harder. We aren't geniuses or saints. We're just people. We get overworked, we make mistakes and get stressed, lose sleep, and we're especially vulnerable to things like burnout and depression. We all want to do good work. We all want to maintain respectable reputations and help our patients do well. But a lot of our work requirements are dictated by non-clinical bodies like insurance companies and lobbyists. Everyone wants us to deliver healthcare effectively and cost efficiently, but we're the ones on the front lines. We have a unique perspective on the actual effectiveness of our healthcare system, and a good healthcare system requires good doctors. So check in with yourself. Are you amazing and already doing these 5 things? Are there other things good doctors do that I miss because I'm a work in progress? If you want to help me be a better doctor, leave me some feedback in the comments. If you've also got room for improvement, hit the like button and subscribe to This Ability Clinic. Thanks for watching.